Hi, good morning, everyone. Good morning, family and friends. Good morning, our followers, and welcome to Muchic Farm. My birds that I've been uploading from day one, they are day old till this week. They are 6 weeks. I want to show some of us what we encounter because different breed with their different sickness presentation at different stages, and we've never encountered this on our years of poultry farming. So I can't just be uploading, oh, it's nice, it's good. What if along the line you experience what we are experiencing now? What will you do? Because as you follow Muchic Farm, we show you everything about birds, their stages, and some of the things, sicknesses you may encounter. And one of the sicknesses we encounter that I've never encountered before is coryza. Look at these birds. Look at this eye. Oh my God. Look at this eye. And look at the other one. I just noticed this one inside, and I've been noticing coryza on my birds, and everywhere is opened. I've given them some medication, and it's as if it's not arresting it. And some of them have put them at the sick bay. Look at them here. And I'm throwing this one. I just noticed this one here this morning. My farm attendant did not notice. So I'm going to throw them on the sick bay. Look at it. It's coryza. I've given medication, and I'm giving them eye drop now that will dry up the wetness and a sore kind of thing. So because I've given them everything I needed to give them, and some of them are still down with it, good and fine, I just resolved in going to be giving them ordinary water. Keep their pen clean and have a lot of ventilation both morning and night, and let them go through the process. And see, I lost 2. And this one, I'm not sure is coryza, but I'll go ahead with my chat. I'm supposed to give them, deworm them this week. So I'll go ahead and deworm them. Their pen is practically dried. I'll go ahead and deworm them. By tomorrow, pack their bedding and put a new one and monitor them, because sometimes when you overflood their system with drugs, they don't know whether the effect of drugs is weighing them down. So sometimes you cleanse their system with ordinary water, open up their pen for vents, and go ahead with your chat and see what happens. So far so good. This is what we experienced this week, and it's just I've never experienced this on my farm, but never to worry. Their progress I will still update. So far, if there is any question, you can see the number on the screen and ask your question. Thank you so much for staying with us. See you on our next upload. Bye-bye. Hello everyone, good afternoon, family and friends. Good afternoon, our followers, and welcome to Muchic Farm. Today is another beautiful day, and like I said on my last video, I don't just upload, oh, it's all well, it's good, no mortality and all that. The other video I made 2 that died, and it was coryza. My birds had coryza, and I've given them medication for coryza. I've dusted everywhere, opened up everywhere, a kind of sanitized everywhere with antibacterial drugs, yet it's as if they are somehow stubborn. So I've just decided to give them oxytetracycline injection today. And because of this coryza, trying to combat coryza, it's a kind of made me not to follow my chart. They are 7 weeks. There will be 7 weeks by tomorrow, and I'm supposed to give them the first NDVK. At 6 weeks, I was supposed to give them fowl pox, but because I was treating them, they're already on antibiotics. I didn't want to stress them by bombarding them with antibiotics and drugs and all that. So I now gave antibiotics, gave coryza drugs, and it's as if this one's on sick bed is not getting any good. So I just decided to give them oxytetracycline injection, and it makes me to push down my chart. So instead of, I'm not giving them fowl pox, remember. So after giving them this injection, I'll place them on vitamin, after which I can now go back and follow my chart and give them fowl pox, give them first NDVK, give them typhoid, and when I'll be giving them all those, I will still upload. So don't be scared, don't be afraid. If you encounter any challenge in your process, just contact us. We will tell you what to do. And we don't just take it by injection. We started gradually opening up, dusting. It was still spreading. Gave them antibiotics, coryza. It was still a kind of not getting any better. We now resolved to the final solution of oxytetracycline. Meanwhile, we've been dusting our environment. So this is my oxytetra. This is my automated syringe. So this is how we give it. I give on the tie. So when you call us, we will tell you how many points, how many meals you're going to administer to your bird, depending on their weight and their weeks. So far so good. This is what the process that will go on in Lolly Muchic farm today. Thank you and have a pleasant day. Bye. Please, this is exactly what I want. This is the injection bottle. I'm inserting this big needle that will help me pump the vaccine to this automatic syringe. This is what I want. I don't know what you're showing me. This is exactly what I want. The big needle here, this one, insert into the vaccine bottle or injection bottle. Then the automatic syringe, it will help me pump it. That's what I want. Hi everyone, good morning and welcome to Lolly Muchic farm. This is my clinic, my sick bay, and I have quite a number of sick infected birds here, down with same coryza. And like the last video I made before this one, I told my followers that I've done everything, every synthetic medication to combat the coryza, yet these ones are weak. Why? They are not eating. Once they are down with coryza, it affects their facial side and their respiratory side system, and it makes them to just stand at a place and watch food and water without eating. So I kind of looked at them. If you're a doctor or a mother and your patient or your child that is sick is not eating, what will you do? You have to help the person. That's what we are doing now. We are helping our birds. I had to do some orthodox medication since synthetic is taking time to take care of the coryza. So I had to do an orthodox one. This is organic. when you comment on the comment box, I will tell you the constituents of this mixture. This is organic that we did here. Look at it. We are helping them. We fill the syringe, and each and every one of them, we try to give them like 10 meals, and we have to repeat this process every 2 hourly to enable them have energy to reach for food and reach for water too. And so far we will repeat it today, repeat it for 3 days, then the progress, we will still upload our progress. Thank you so much, our fans. Thank you so much, our fans. Thank you so much, our fans, for staying and sticking with us. This is what we are doing. We are helping the birds. In case you encounter challenge that is making your birds weak and not reaching out to their food and water, this is what you do. You help them out every 2 hourly. Your medicated water, you pull into your syringe and give to all of them. It will make them have energy to reach for food. You will find out that once you do it a day and 2 days, they will be strong enough to recognize food and water and have it in their system. So thank you for staying with us. See you next week. Bye.